Hi, just doing my daily check-in. Today I've been at a conference all day, which was very intense and really educational. I'm feeling quite tired today, though I think there's a little bit of jet lag kicked in. So the conference today was wrapping up a project that African Enterprise has been involved in, and it was a partnership between a medical board. I have written all of this down, but a medical board, dignitaries and religious leaders, and they've all joined together to educate people through the faith leaders of the country about personal hygiene to try and overcome monkeypox and another disease which they called it MVD. Anyhow, it was a very successful project from all reports. There were a lot of challenges working together. There was faith leaders from different faiths, so that the Muslims were represented as well today. And they were talking about how they'd gone in to churches and educated people, and it sort of filtered down through from the leaders to the grassroots movements in the communities across the country. So part of this education involved getting people to wash their hands, not to hug when there's an outbreak, or shake hands, and try and do some social distancing, I suppose, and also the benefits of vaccination, covering your mouth, staying home when you're sick, that sort of thing. So they had a lot of success with this, and they're just some of the challenges now, I guess, going ahead is to keep people engaging in those behaviours in the hope that this might have a big impact on the number of cases of other sicknesses in the country. So yeah, it's just making people aware and ongoing education about it, keeping it forefront in the minds. So they were talking about how they've tried to do that, like some of the tactics they have used to speak to people, and the different groups pledged how they were going to continue the work, and there was talk of future projects as well. One of the things that was interesting for me, particularly with the awareness that we have at the moment of how the funding cuts from USAID have impacted the Centre for Champions. This was a project that was also impacted. So just as they had started the project with the US investing in it, they withdrew the funds and told them to cease working immediately. So they were challenged to basically try and find other funding, different ways of getting the message out and continuing the work, and they were able to do that. But I think it was challenging. Some of it was a bit lost in translation. I had a translator, but yeah, they were still successful. So that's it's encouraging. But they're still, I think, trying to make partnerships with various different groups, AE being one. So yeah, the leader of the project was actually from African Enterprise, and she was very just spoke so well, and very inspiring. Like, she really ran the project well, and just was completely all over it. Like, her knowledge was amazing. So that was that was really good. I have to giggle because there were so many dignitaries there, and I rocked up in my Converse and my sort of backpacketed clothes on. I was so underdressed and the only white person in the room, so I really stood out. And they sat me down next to the Archbishop of Rwanda, who is the most lovely man, and I really enjoyed speaking with him, and he spoke about his life and some of the challenges that the church is facing. He actually worked for Compassion for many years, and he's still on the board. And so he was fascinating to speak to, and lived in the United States for about 21 years. So I heard a little bit about that and some of the ministry challenges that he had there. So he was, an amazing man. But then I was at this table at lunch with the archbishop and some other bishops and like this high-level doctor and the mayor, and I was like, oh my gosh, please don't look at my shoes. I'm so embarrassed. So, so I'm going to go perhaps tomorrow with Eliane, who's been taking me around. And I said, can I just get some nice shoes for church? I feel so embarrassed because apparently we're going to go to his cathedral and hear him speak. So I want to try and make a slightly better impression. But yeah, there was some really, and there was a pastor there who was translating for me, and he was sharing a bit about the genocide. And unfortunately, we got interrupted, but he was saying, you know, it's really great to see the country working together in all of these religious groups and the health and the various leaders of the community working together to make sure everyone is informed and trying to have a healthier future. One of the other interesting concepts that I really liked was they were talking about if you have a healthy body, then you are quite often spiritually healthy too. So if one is not well, the other is not well. So it's a holistic approach to trying to help the communities. They want to make them spiritually and physically well, which I really liked. And yeah, so that was a really, really good concept. And I think it's something that maybe we don't, you know, I know that mental well-being is talked about in Australia, and physical well-being promotes that too, but the spiritual well-being is spoken about here quite a lot, and it's, you know, it's important. Some of the challenges that they have implementing these programs is that they have traditional healers who gather people in areas of high transmission, and the fact that people are close together and just praying for healing or whatever traditional medicines they might give them, it's not effective, and they're sort of trying to demystify some of that. People of faith will pray to become well and put it in God's hands, and they're saying, you know, yes, you should do that, but you should also take the medical advice too. So that's a challenge. Yeah, it was a very interesting day. I'm sure there was probably a lot more that I didn't get. I do have a lot of notes written down, a few questions that I had to follow up on. So one of my questions from yesterday that I was speaking to John about today was, so how did they first make contact with vulnerable communities? And he was saying that in Rwanda, everybody is given a status of poverty. So everyone gets a number. They all get a number of where they are financially, and the government uses that as a census, and they are able to identify with the areas that have got very, very severe poverty, and within those areas, who are the most vulnerable within that poverty community, impoverished community. So then they make contact with the churches in those areas, and they are able to make connection with these extremely vulnerable people, and then bring them into their projects and start to help them. So they do share the gospel, but not everybody in their projects, he was saying today, is necessarily a Christian. They still bring them in, but they plant one person. He said it only takes one person in that group to be a Christian, and then it's a relationship thing. So they build relationships with the participants, and over time they share the gospel, which is, you know, it's all about relationship, isn't it? I like building trust, sharing stories and sharing hope, and it just is such an effective way, and, you know, just to use the census to identify and contact community leaders. I was curious about how they find the people, but that's how they do it, and, you know, go on to make these significant changes in their lives and support them. And it's not just while they're in the programs, they're still, it seems to be ongoing. So yeah, it was a big day. So then Eliane took me to get my nails done, And hopefully next time I see any of these dignitaries, I won't look so shabby. Anyway, so yeah, no, it's been a very informative day, and tomorrow I'm out to see some more children. So I'm very much looking forward to that, and we're heading down to the south of Rwanda. So I'm going to go and get a little bit of rest because I am feeling a bit tired today, and not so much from running around, but just the information that was so intense today. I feel like I've sat through about 5 hours of uni. It was a lot to take in. Anyway, that's all from me for now.